This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Thursday, April 9th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staff at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us. Africa 54. The numbers continue to be grim in the global fight against the coronavirus pandemic worldwide. The confirmed cases of COVID-19 now tops 1.5 million, and the reported deaths from the deadly virus has soared past 89,000 people. The United States has by far the most cases in the world, with at least 430,000. The biggest cluster of those cases is in New York State, where reported infections near 150,000. More than 6,000 have died in New York City from the coronavirus. The state reported a record high 779 deaths on Wednesday. Governor Andrew Cuomo points to reductions in hospital admissions as a sign the situation in his state could soon be brighter. Now to Africa, where the Ethiopian Prime Minister Abiy Ahmed has declared a state of emergency to help curb the spread of the coronavirus. Ethiopia has recorded 52 cases of COVID-19 and 2 deaths. In a financial forecast on Thursday, the World Bank says the rapidly spreading disease is expected to push sub-Saharan Africa into recession this year for the first time in 25 years. The bank's Africa Pulse report says the coronavirus will cost sub-Saharan Africa $37 billion to $79 billion in output losses this year due to trade and value chain disruption. Overall, Africa is reporting 11,000 cases of COVID-19 with 562 deaths, but also over 1,100 recoveries, according to a Reuters count based on government statements and World Health Organization data. Nigeria's COVID-19 lockdown may be saving lives, but workers in the informal sector are being greatly impacted by the shutdown. Emma McCarthy reports.
Lagos tailor Kemi Adepoju is sorting through dozens of dresses, most which will never get the chance to be worn. The glamorous Lagos party scene means she's usually kept busy, but these dresses are unlikely to ever get to be collected due to Nigeria's lockdown. Like millions in Africa, Adepoju works in the informal sector, which accounts for more than 85% of employment across the entire continent, and will be largely bypassed by meagre economic support measures that cash-strapped governments are rolling out.
The government should help us to end this so that people can have their parties. It's only when people organise parties that we get money to eat. We have nothing to sell. We are tailors. The government should help us.
Nigeria's government says it has begun making cash transfers to the country's poorest households, but many hawkers and other informal traders do not have bank or mobile money accounts to pay into, even if they were eligible. But Abuja food vendor Tijani Bilakisuwo is not interested in the cash transfers.
The lockdown should take longer than it's supposed to. You know, people won't have money to purchase food again. So everything they'll be taking will be on credit, and it will affect us a lot. So my prayer is that the coronavirus, like the COVID-19, should just come to an end before the 2 weeks break that has been given to everybody, so that everybody will go back to their normal life and work as they used to.
The coronavirus crisis has piled more pressure on the Nigerian government's finances at a time when it was already struggling thanks to a slump in the price of oil.
That was Emma McCarthy of Reuters reporting. Amid the battle against the coronavirus pandemic, a South African university is using its cutting-edge 3D printing technology to manufacture visors after healthcare workers reported shortages of personal protective equipment. David Doyle reports.
A South African university is putting some of its most sophisticated technology to work in tackling a shortage of protective medical equipment. The University of Pretoria has deployed its 3D printers to manufacture visor frames for face shields. Each of its 3 printers takes about an hour to produce a visor. layering up around 20 per day. The project is being led by the manager of the university's Digital and Innovation Centre, Isaac van der Walt.
3D printers allows us to act quickly to this demand. It's rapid prototyping, so it's not mass manufacturing, but with 3D printers we have the ability to react to this call. And I think we need to give our healthcare workers all the help they can get.
From Gaza to Greece, France to the Philippines, enthusiasts of 3D printing, also known as additive manufacturing, have responded to increased demand for medical equipment. On Monday, the World Health Organization voiced concerns that the wearing of medical masks by the general public could exacerbate a shortage for healthcare professionals. And in South Africa, local media reported complaints last month that some of those working on the front line were having to reuse the masks that are meant to protect them.
That was David Doyle of Reuters reporting. The global health community is holding its breath as COVID-19 pandemic continues to spread. Across Africa, delays in testing and poor health infrastructure is contributing to likely underreported cases. VOA's Arasha Rabasadi reports on a recent Voice of America town hall in which experts answered viewers' questions about the continued spread of the coronavirus.
Hello, I'm Lina Hormoudou. Welcome to a special edition of Straight Talk Africa on the coronavirus.
In Washington, Voice of America's Africa division recently held a special online town hall with experts dispelling rumors and answering viewers' questions on COVID-19.
How is the coronavirus different from other viruses like flu and others?
We've never experienced this virus before. Humanity has never seen this. So every one of us is at risk.
Another difference is the rate at which the pathogen spreads. On average, someone with the flu could infect one other person. With coronavirus, that number jumps to anywhere from 2 to 3.
How is the healthcare system able to assist those who are infected?
Each state must have an emergency operation center of at least minimum 300 beds. Consumables, i.e., the PPE, face mask, and the rest of them will be made available to all the states of the Federation.
How are communities reacting to this COVID-19?
People still think that COVID-19 is from Western, that white people are more vulnerable. And in Burkina, for example, the community see them as rich people.
That misconception comes from a belief that only rich people can afford to travel abroad. Dr. Mumini Nayon of Burkina Faso says dispelling myths and providing accurate information is vital. Mudu hands off to an Ethiopian doctor working in New York.
What is your day like when you get to the hospital, briefly? What can you tell us?
When you walk into the waiting room, it's now an emergency room where you see patients coughing, complaints of fever and headache. When you walk into the emergency department, you see a lot of patients on a ventilator. We're running out of burial spaces that would have to start using park spaces for burials.
VOA Special Town Hall premiered April 8th. Arasha Rabasadi, VOA News, Washington.
The Italian government has ruled that the country's ports cannot be considered safe because of the coronavirus pandemic and will not let charity migrant boats dock. The decision was taken late on Tuesday after a ship operated by the German non-governmental group CI picked up some 150 people off Libya and headed towards Italy. After a relative lull in arrivals of boat migrants from Africa, numbers had started to pick up again in the first 2 months of the year, only to fall back sharply in March as Italy was hit by the coronavirus pandemic. The national emergency is set to expire on July 31st, but the deadline might be extended. CI is calling on Germany to take in the migrants. U.S. President Donald Trump lashed out at the head of the World Health Organization, who called for unity and global solidarity after Trump accused the United Nations agency of being China-centric and threatened to suspend funding. White House correspondent Patsy Widakuswara has more.
At a time when the World Health Organization should be focused on dealing with the coronavirus pandemic, is facing criticism from its biggest donor. U.S. President Donald Trump accused the WHO of not being aggressive enough in confronting the virus and threatened to suspend funding. In response, WHO Director General Tedros Adhanom Ghebreyesus called for for unity and warned against politicizing the crisis.
No need to use COVID to score political points. No need. You have many other ways to prove yourselves.
So when he says politicizing, he's politicizing. That shouldn't be. But look, we spend $450 billion, $452 billion, almost $500 billion last year, hundreds of billions in previous years. And they got to do better than that.
Trump accused the WHO of being slow to react to the pandemic, despite it declaring COVID-19 as a public health emergency of international concern weeks before the U.S. declared a national emergency. Trump also accused it of being China-centric. The agency has praised China's response to the pandemic, and critics say it may have been too trusting of Beijing, who initially tried to conceal the outbreak in Wuhan.
That there is both a legitimate concern here about the WHO perhaps pandering to China. There is some evidence of that, although it's to be determined. We don't really know. And then there's also a concern that perhaps the Trump administration is using this as a scapegoat to distract from its own rather late and ineffectual response.
Publicly, Trump has welcomed China's global role in the pandemic. Earlier this month, he said that he views it as a positive if Beijing is helping other countries. Hatsivida Kuswara, VOA News.
Following a phone conversation between U.S. President Donald Trump and Russian President Vladimir Putin in late March, Russia shipped 60 tons worth of medical supplies and equipment to the United States. But the Russian aid was not a purely humanitarian gesture. Alex Yanevsky has a report narrated here by Anna Rice.
A Russian military plane carrying 60 tons of medical equipment arrived in the U.S. at the end of March. The plane landed in New York, the American city that has been hardest hit by the coronavirus pandemic. Among the equipment brought from Russia were face masks and ventilators. Russian Press Secretary Dmitry Peskov said Russia's intent was to help the U.S. deal with the rapid spread of COVID-19, adding that President Trump gladly accepted this humanitarian aid. But according to the U.S. State Department, the equipment and supplies were paid for in full by the U.S. A press statement on the State Department website said the U.S. agreed to purchase the needed medical supplies, including ventilators and personal protection equipment from Russia, following a conversation on March 30th between President Trump and President Putin. Later, Russia's Ministry of Foreign Affairs stated that half of the supplies were paid for by the Russian side, while the other half by the U.S. On the same day, the State Department issued another statement saying the supplies were indeed purchased by Washington, yet for a discounted price. Heather Conley, an analyst at CSIS, says Russia's intent may not be completely altruistic.
When countries and nations are having an emergency, usually those offers of goodwill are designed to try to create a better environment. But on the other hand, the Kremlin could certainly use this as demonstrating that the United States is not managing the crisis very well.
For the Kremlin, the shipment was a propaganda coup, says analyst Michael Carpenter of the Penn Biden Center for Diplomacy.
The intention, obviously, is to make it seem as if it's a humanitarian gesture, which in itself would be fine, only that this material, as I just said, is going to be more badly needed in Russia than it is here.
However, the aid gesture received only cursory treatment in Russia's state media, perhaps a reflection of the growing concerns in Russia over the coronavirus outbreak. For Alex Yanevsky in Washington, Anna Rice, VOA News.
Market shares were on the upswing in Asia Thursday as investors once again expressed hope that the novel coronavirus pandemic was nearing its peak. Australia's S&P ASX index gained nearly 3.5% at the end of its trading session, with Hong Kong, Seoul, Shanghai, and Mumbai also posting positive gains. Japan's Nikkei index lost a fraction of 1% as the country faces an increasing number of confirmed COVID-19 infections. The rising numbers in Asia mirrored Wednesday's closing numbers on Wall Street, with the Dow Jones and the S&P all gaining 3.4%, while the Nasdaq finished 2.6% higher. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, the influence of Black immigrants and their economic contribution in the United States. We'll be right back after this short break.
People, now you ready to ride? Remix, Mr. Flavor, Vanidance Art, and a shower remix. Holding go continue.
Welcome back to Africa 54. It's usually the most crowded week of the year in the Eternal City. But for the first time in recorded history, Rome, including the Vatican, are deserted at Holy Week as thousands of pilgrims stay away for fear of exposure to COVID-19. Sabina Castelfranco reports from Rome.
No traffic, empty piazzas, and no tourists. This is Holy Week in Rome this year, the Eternal City as no one could ever have imagined. Surreal due to the coronavirus outbreak. Time seems to have come to a standstill at famous Rome landmarks like the Trevi Fountain and the Colosseum, normally bustling with people. Rome Mayor Virginia Raggi said Rome is deserted and Romans are taking seriously the new rules of daily life needed to stop the deadly virus from spreading. On Palm Sunday, the start of the Holy Week, a solitary Pope Francis addressed the world's faithful from an empty St. Peter's Basilica.
The tragedy we are experiencing in these days summons us to take seriously the things that are serious and not to be caught up in those that matter less. To rediscover that life is of no use if not used to serve others.
Palm Sunday this year in Rome. In a normal year like in 2019, thousands gather in St. Peter's Square, waving palm fronds and listen to the Pope speak. This year, all Holy Week ceremonies will be held behind closed doors inside St. Peter's Basilica, except for one, the Via Crucis, or Way of the Cross. That solemn moment that recounts when Jesus died on the cross will be held on Friday evening in an empty St. Peter's Square.
Sulle nostre strade da molti.
The Way of the Cross is traditionally a candlelit procession held at Rome's ancient Colosseum and attended by tens of thousands of faithful. In an extraordinary Urbi et Orbi message last week, Pope Francis said, "We have realized we are in the same boat, all of us fragile and disoriented, but at the same time important and needed. All of us called to row together, each of us in need of comforting the other." On Sunday, eyes and hopes will be on an empty St. Peter's Square, from where Pope Francis will deliver his Easter message. Sabina Castelfranco for VOA News at the Vatican.
Israel Prime Minister Benjamin Netanyahu, the head of the Mossad security force, and other officials entered home quarantine after Israel's health ministers tested positive for COVID-19. The health minister belongs to the country's ultra-Orthodox community, which has resisted government bans on large gatherings. Linda Grunstein reports from Jerusalem.
Prime Minister Netanyahu returned to quarantine just hours after emerging from a one-week isolation. His government's health minister, Yaakov Litzman, who is 71, tested positive for coronavirus and is reported to have mild symptoms. A senior health official said Litzman may have contracted the virus from fellow members of the ultra-Orthodox community, where the disease is spreading fast. The Israeli Health Ministry set up a coronavirus testing facility in the ultra-Orthodox city of Bnei Brak, and officials were shocked by the results. More than 1/3 tested positive. Today, the hospitals say that up to half of their coronavirus patients are ultra-Orthodox. The Israeli government outlawed all public gatherings, including at Judaism's holiest site, the Western Wall. But synagogues, religious schools, and mass religious ceremonies stayed open until the police began to enforce their closure in the last few days.
We also had the schools that were open until just recently. And now we just found out that the principal of one of these schools has the coronavirus, and now every single one of the children, hundreds and hundreds of children in Jerusalem that were in this school, and these are not large school buildings with large open courtyards, everyone pressed in, classes of the 20, 30, 40 children, hallways that are very narrow, and now this is the way that it has spread in such a quick manner.
Some in the Haredi, Hebrew for ultra-Orthodox community, claim that the health minister should have enlisted rabbis to explain and enforce the restrictions rather than the police.
Everybody knows if you want something from the Haredi society, go to the rabbis. He had to gather prominent rabbis, address them with facts, and make sure that they would deliver it to their communities. We all saw that once we had letters from rabbis, numbers of people on the streets dropped dramatically.
This doesn't make any sense. Going to synagogue is important, but it's not something which you can't violate in order to save lives. And it's a tragedy that a community which does hold life to be on such a high value was not understanding early enough the significance and the seriousness of this threat.
Some ultra-Orthodox extremists have a deep distrust of secular state authorities and even clashed with police who came to their neighborhoods to enforce the orders. But many religious Israelis are struggling to obey the restrictions as they prepare for next week's holiday of Passover, when Jews gather with their extended family for a festive meal called the Seder. Not this year, says Israel's defense minister.
I forbid every Jew in the world to do a Passover Seder with grandma and grandpa. Even if you think you can isolate them from doing it from 20 feet away, you can't. They will get the coronavirus. There's no way to have a 2 or 3 hour Seder without your mother and father getting the virus, and it is lethal.
For many in Israel, it will be a subdued holiday as the country continues to struggle to get the virus under control. Linda Gradstein for VOA News, Jerusalem.
In a business report since 2010, the number of Black immigrants in the United States has risen by 30%, and their economic contributions have also climbed, now in the billions, according to a new report called The Power of the Pause. Africa 54's Ayen Dengbyor spoke with Andrew Lim, the director of the quantitative research at the New York-based New American Economy, who says this group of immigrants is becoming increasingly influential.
I think when you talk about immigration in the context of the United States, you often only talk about Hispanic immigration or Asian immigration to the U.S. And what gets lost there is this, this growing population of Black immigrants, whether they come from sub-Saharan Africa or the West Indies or other parts of Central or South America. There are a significant population, both economically but also demographically, to the United States.
There has been a 30% rise in the number of Black immigrants who have arrived in the U.S. since 2010, and their economic contributions is in the billions, as is their contributions to the U.S. tax system. Why do these figures matter?
30% from just 2010. So that's an increase of from 3.3 million in 2010 to 4.3 million in 2018. And you mentioned their economic contributions. And so as they grow in number, they also are growing in economic clout. And so just in 2018, we already saw that Black immigrant households earned a total of $133.6 billion. And that allowed them to pay a significant amount in taxes as well. So you think about $22.8 million in federal income taxes, but also $13.2 billion in state and local taxes. And so if you actually think about their income minus the taxes that they pay, that still leaves them with a consumer power that's equal to $97.6 billion. So not an insignificant amount at all.
You know, Andrew, as a journalist, I don't like to inject myself in stories, but as a Black immigrant myself, I know the challenges that my family had trying to get to school, trying to learn English, trying to pay for school, trying to get jobs, knowing the challenges that Black immigrants face. Why do you think these numbers continue to be so significant?
I think these numbers are so significant for a couple of reasons. One, I think Black immigrants in particular, from the data that we've seen, are actually very skilled. I think contrary to a lot of rhetoric that you see from certain politicians or people in the media, Black immigrants have a lot to offer the United States in terms of their skills. If you look at the situation that we're currently facing in the United States in terms of this health crisis and the coronavirus, healthcare is a huge industry for Black immigrants. Especially as nurses, personal care aides, medical assistants, et cetera. Almost 3 out of 10 Black immigrant workers, that's more than 750,000 people, are working in the healthcare sector. So that's one way, their skills and their propensity to working in healthcare is one way that they're positively impacting the United States.
So how can this information be used in the world, be it in policy, education, or the workforce?
Yeah, I mean, this data really shows how significant the population is now. And again, as I said, will only continue to increase. What really, I think, would be the most important takeaway is that people should pay more attention to this group of immigrants in particular. As I said before, a lot of the debate around immigration really is dominated by discussions about Hispanic immigrants or Asian immigrants. But really, we're not getting the full picture when we talk about that. So to include Black immigrants in these kinds of conversations about immigrant integration, about expansion, or ensuring that all people have access to the right information so that you're going to communities, that you're reaching all the communities, in your city or your state, including Black immigrants, is just something to keep in mind.
Africa 54's Ayeng Dengbyor speaking with Andrew Lim, Director of Quantitative Research at the New York-based New American Economy. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.